during these unprecedented times. Today is day one of the statewide stay-at-home order, and I'm fully aware of how this mandate is a challenge and burden for everyone across Hawaii. I cannot stress enough the importance of staying at home or in your place of residence. This is the only way we are going to slow down the spread of COVID-19 in Hawaii. I know our community understands why this order is necessary. However, it impacts our neighbors who have lost their jobs and businesses that have closed their doors. Today, I'm announcing state programs available to provide relief to residents directly impacted by this crisis. The Hawaiian Homes Commission has approved the deferral of mortgage payments for the Department of Hawaiian Homeland's direct loans for a period of 6 months. Hawaiian Homes Commission Chair William Ila will provide more details on the program. The Hawaii Department of Human Services provides important safety net services for the most vulnerable in our community. They are announcing today several measures to ensure that essential services will continue to be available and continue uninterrupted. This includes Supplemental Nutritional Assistance Program, or SNAP, child care facilities and homes, and MedPlus. DHS Director Pankaj Banoy will provide more details. The COVID-19 crisis has also created a lot of uncertainty for Hawaii's graduating seniors. University of Hawaii President David Lassner is also here to announce that they will extend the application deadline for UH Manoa, UH Hilo, and UH West Oahu for the next academic year. This will help to ensure that the graduates will be able to attend college in the fall. And from the Department of Health, Dr. Bruce Anderson will provide an update on the latest number of COVID-19 cases in Hawaii. But before I turn it over, I would like to address an issue that many have been calling my office to inquire about. Let me make it clear that my overriding priority is to protect the health and safety of Hawaii's people. This is what we all need to focus on. Anything else at this time is an unnecessary distraction. Lieutenant Governor Josh Green is still the healthcare liaison for the state of Hawaii. Nothing has changed since his being appointed to that role. The Lieutenant Governor is charged with evaluating the medical community's readiness to deliver care to individuals who test positive for COVID-19, evaluating Hawaii's current equipment supply, including personal protective equipment and ventilators that are so crucial in providing care, and coordinating efforts to secure additional as needed, and advocating for funding at state and federal levels. I welcome the advice and suggestions from the Lieutenant Governor Green, as well as anyone else who has recommendations on how we protect our community. However, as governor, I developed my health policies related to COVID-19 with the advice and guidance of national experts from the CDC, the Hawaii Department of Health, and Drs. Bruce Anderson and Dr. Sarah Park. Both Drs. Anderson and Park are trained epidemiologists whose careers have been devoted to the study of preventing epidemics. I have been working closely with our county mayor and my department directors on policies to protect our communities, and I ask all other elected leaders to put aside their personal agendas and do the same. Mahalo.
Our next speaker is William Ila, Director of the Department of Hawaiian Homelands. And before we move on, Again, if you just joined us, please mute your phones. We just heard someone cough, so we know that someone's not muted. Please mute your phones. Thank you. Mr. Aya.
Aloha. Yesterday, with the strong support of the governor and the approval of the Hawaiian Home Station, the department is hereby authorized to postpone mortgages from our direct loan programs starting in April and going on for 6 months. There are more than 1,200 of these mortgages. For mortgages with private institutions, and there are more than 3,900 of these, I urge you to make contact with your lender. The department has also sent a letter to HUD Secretary Bruce Carlson requesting that both the 184A and 247 HUD programs adopt similar stances to what the commission approved. If you have any questions, make sure you call your lender on this issue. This is a postponement of payments for the next 6 months. Thank you.
Thank you, Mr. Ayala. Our next speaker is Pankaj Vinod, Director of the Department of Human Services.
Aloha, everyone. Thank you, Governor, for the opportunity to provide some information related to very critical programs for our residents across the state of Hawaii. The Department of Human Services is taking aggressive actions to protect the health and safety of the individuals and families we serve by maintaining essential services to help the people of Hawaii during the COVID-19 crisis. We are working collaboratively with the community, with the department leadership, with the executive departments of state of Hawaii, particularly the Attorney General's office, and our federal partners to ensure that we are providing uninterrupted services to our residents who are currently receiving the services and all future applicants for all our services. However, we are doing that in a modified manner, and that means limiting face-to-face contact with the public to protect the health and safety of everyone, especially vulnerable individuals, as well as DHS employees and providers. We have already begun to receive and process new applications for benefits and services in response to COVID-19. Our essential services will continue uninterrupted, and our employees shall continue to report to work from the office, the current locations where they provide services from, or remotely from home. During these challenging times, we'll continue to serve our state with aloha. Together, we honor our commitment to supporting our collective community, individuals, and families from Keiki to Kupuna. I have a lot of information that I want to provide regarding critical benefits and services, starting with SNAP, the Supplemental Nutrition Assistance Program, which is also formerly known as food stamps. First, there is a reduction in staff at administrative offices and our processing centers where we normally provide services out of, but they are working hard to manage the workload and provide reduced exposure for all. Please be patient with our staff as they work as quickly as they can to process requests and applications. Telephone will be the primary means to contact BESD, Benefit Employment and Support Services Division, processing centers, and other offices. Please refer to the DHS website at humanservices.hawaii.gov for the phone number of the processing center nearest to you. If you visit a processing center, signage will instruct you to drop off your forms in the drop box and to contact the office by phone. The phone number will be posted on a sign there for your convenience. While the lobbies are officially closed during the pandemic, if you do not have access to a phone, signage will instruct you how to alert BESD staff at the center that you have no phone. Staff will work with you in all possible ways to serve you. Hawaii Electronic Benefit Transfer, the EBT card on which the benefits are loaded, will be mailed to the address you provided in the application instead of being picked up in person. Please ensure that the address provided is correct. Now I would like to talk about the first-time applicants. If you're applying for the first time, we invite you to use the electronic fillable application that is available on the DHS website. It's humanservices.hawaii.gov. Once complete, you may print, sign, mail, or drop off the application at a processing center nearest to your home as noted above. Or if you're unable to place your signature on the page, you may scan or take a photo of the signature page and send it as an email attachment to BESD, B-E-S-S-D, dot statewide branch, one word, at dhs.hawaii.gov. The current recipients of SNAP, there is a change in that as well. SNAP certification period for recipients requiring 6 months review or eligibility reviews during the months of March, April, and May will be extended an additional 6 months to ensure no lapse in benefits due to the pandemic. A notice will be sent to you at the last known address on file via U.S. Postal Mail providing more details. Please do review the notice. Notice will have very important information that you may be required to provide to the department to provide you with benefits on an ongoing basis. Due to this pandemic, U.S. Department of Agriculture, the Food and Nutrition Service, has also waived the able-bodied adult without dependents work, education, and training requirements. This is in response to the decline in available work and closure of training courses due to the pandemic. We have also requested a waiver for part-time students, those who are less than full-time, who are unable to meet 20-hour per week work requirement to maintain their SNAP benefits. Hopefully we'll get that waiver and we'll provide additional information to the applicants and to the residents at a future date. And this is warranted because of the closure of all the food establishments, entertainment, and recreation businesses because of the pandemic. Furthermore, we are doing many more things to ensure the seamless and uninterrupted availability of our benefits services across the state. So please be patient as the federal requirements change and we come up with creative ways of ensuring the uninterrupted way of providing benefits and services to the residents of Hawaii. Please be patient and wait for that information to come, because we are not open for face-to-face contact. Most of the queries have to come through online, email, or through phone. Regarding I want to talk about Medicaid. It's a lot of questions are coming in for Medicaid. First of all, I would like to say is that like all other healthcare services we provide through Medicaid, there are no co-pays for services related to COVID-19 for MedQuest. We also encourage all our Quest recipients and future applicants for healthcare insurance to apply online if you're in need of healthcare insurance. If you do not have access to a computer to apply online, staff are available to help you complete an application over the phone. Please note that due to the current situation, phone wait times are longer than usual. More details with application links and contact phone numbers are available on MedQuest's website, and that is https://medquest.hawaii.gov. One more important point regarding our MedQuest division. MedQuest will postpone implementing new contracts regarding health plans until further notice, as we are fully devoted to responding to this public health crisis and making sure MedQuest beneficiaries receive the care they need. Please continue to contact your current provider under your existing health plan. One more point. This does not mean that the current procurement that is underway has stopped. That will continue. But until further notice, current contracts remain in force. Now, a little bit talking about supporting individuals with disabilities. Most of the programs, services, and benefits currently provided by the Division of Vocational Rehabilitation, they will continue uninterrupted through telephone or through online services. Supporting houseless individuals and families. All DHS-funded homeless shelters and outreach programs are also considered essential services. DHS Homeless Programs Office is maintaining close contact with providers and are working with them to provide flexibility with contract requirements and have established weekly office hours for our providers in partnership with the Department of Health and Behavioral Health Services Administration. Homeless Services outreach staff continue to make sure basic services are provided and offered to unsheltered individuals. DHS has also been in contact with domestic violence shelters and is working to ensure these essential services continue. Now, a little bit about child welfare and adult protective services before I make a couple of comments regarding the availability of child care subsidies and child care providers-related issues that we are getting a lot of questions about. The health and safety of our families and our staff is a priority. Child welfare services.
We're getting feedback. Okay, we're getting feedback, guys, because someone is not muted. Please mute your phones. We will stand by and wait until you do so. Are we muted?
The health and safety of our families and employees are our first priority. Child welfare services and adult protective and community services branch will continue to respond to reports of any instance of abuse, neglect, harm, or exploitation. We have advised our staff to adhere to social distancing when visiting homes, at least stay 6 feet from the other person. We have advised our staff to adhere to all other Department of Health and CDC requirements regarding the COVID-19.
Please mute your phones. We can still hear you, and we're getting feedback. We are unable to continue with this news conference until we're muted.
For information regarding child welfare services, hearings in family courts throughout the state, please visit the judiciary website at https://www.courts.state.hi.us. Due to strict social distancing, family visits between parents and children are being modified, and arrangements are being made through video conferencing methods and other technological means. Now with childcare, we are going to continue our childcare operations both on the subsidy side and the childcare licensing side. Each individual childcare facility or home is assessing whether it will continue to operate and offer services. Some facilities and homes are continuing to provide childcare to essential workers during this time of need. The State Emergency Operations Center, EOC, in consultation with the Department of Health, are the lead entities to identify if a case or a person under investigation is associated with a childcare facility or home. If it is determined that anyone at a childcare facility or home may have been exposed, EOC and Hawaii Department of Health will work closely with the affected childcare facility or home to minimize the spread of illness. Hawaii Department of Health and the Centers for Disease Control have guidance for schools and universities, which also applies to childcare facilities and can be found at the Department of Human Services website. That is at humanservices.hawaii.gov. DHS is continuing to identify ways to provide emergency childcare for first responders and will be providing more updated information in the coming days. We are working daily alongside our Attorney General's office, federal partners, community partners, and stakeholders to ensure continued childcare for essential workers in our community. Thank you.
Thank you, Director Bernot.